Okay, so if a woman suspects she has AS but is having trouble getting diagnosed, what should she do? Because there don't seem to be many experts in the UK, let alone the world, who deal with Asherman syndrome.
It should be reasonably easy to make the diagnosis. I think that the problem is that it doesn't reach consciousness in the majority of obstetricians and gynaecologists because it's so rare. Most specialists in this country probably see 1 or 2 cases in a year, and so they wouldn't necessarily think of investigating for that. But if you're worried and you think you've got Asherman syndrome, then you should go and see your GP and ask him to refer you to a gynaecologist, and a general gynaecologist will do to make the diagnosis. If you want to be referred to an Asherman specialist, then there are people who have expertise in this area in many parts of the UK.
Because if you're told that you need surgery and you do have AS, how important would you say it is to actually find a specialist to perform the operation?
I think it's really important that the first operation that's done to treat Asherman syndrome is done by somebody who does it all the time. When we're treating Asherman syndrome, it's important to have the opportunity to be able to do it under X-ray control or ultrasound control, to do it in a theatre with tiny instruments, with very small telescopes which don't cause significant dilation of the cervical canal, and for specialists who have complete familiarity with what the tissue looks like and how to find your way through the areas of scarring to do the procedure first time, because otherwise it's very easy to get out of what should be the cavity of the uterus and get into a false passage and create an opening where there really shouldn't be an opening outside the womb, and then say, right, I've done a great job here, we've got a nice triangular shape inside the uterus, but actually there's no endometrium there. It's never going to re-epithelialize and become recovered with endometrium. So it's much better that it's somebody who's specialised at doing it, who treats it first time.
And how successful is surgery to treat AS? Obviously we know that there are different grades of it.
It depends how extensive the Asherman syndrome is. If you've got localised Asherman syndrome, then once you've divided those adhesions, the endometrium will grow back again, and it's very successful as long as you get the treatment in the right place, recreate the cavity in the right place. If you've got a cavity that's completely obliterated, then sometimes you can find it very, very difficult to restore a cavity, and there's a tendency for adhesions to reform again, and you sort of go 2 steps forward and 1 step back, and it may take 2 or 3 or 4 procedures before we've got a cavity that's usable.
What can be done to prevent AS then in the first place?
I think it's really important that doctors performing procedures are aware of the possibilities of Asherman syndrome, that wherever possible, ERPCs are done under ultrasound control, so that we're using another method to identify where the bits of tissue are that are potentially adherent and need to come away. And if necessary, then we leave 1 or 2 bits of pieces of tissue inside the uterus as long as the bleeding has stopped, and we can go back and do a hysteroscopy later on. I think over-aggressive curettage of the uterus is the worst thing that you can do, and being gentle and having respect for the tissue is the most important issue.
So if a woman's told that she needs to have a D&C, are there other options available to her?
If she needs to have a D&C, I would recommend that she asks if it can be done under ultrasound control. She could consider having a miscarriage managed medically. I'm not a big fan of medical management because often we find that bits of tissue are left behind, and that it can take a long time for what is a very unfortunate situation. Usually it's a miscarriage, usually it's a very much wanted pregnancy, and you feel very empty inside when you have a miscarriage like that, and you naturally want to get rid of the tissue and draw a line under that pregnancy as soon as possible.